And your first question is from Tanya Fletcher.
Oh, hi there, Minister. Can you hear me now?
I can hear you.
Okay, great. Thank you for the availability. Just wondering here, I have a question from my colleague who wants to know if the province is in any position to compel LifeLabs to provide any additional information in this case.
Well, here's what's happened. We have the Information and Privacy Commissioners of B.C. Ontario have prepared a report. I'm a Minister of Health and I'm a citizen of B.C. and I want to see the report. We know that that this is a serious issue that every health system is facing right now. That health systems all over the world are under, I'd say, constant attack, daily attack, minute-by-minute attack. And so this situation occurred in BC. You'll recall I responded at that time, and the health system responded at that time. This occurred, we were informed in the end of October, October 28th and 29th, that we were told on November 7th that a breach had occurred that included records in BC, more in other provinces, but records in BC. And on December 17th, that information came out to the public. At that time, the Privacy Commissioner, who was also informed at the beginning, and the Information and Privacy Commissioner, Mr. McAvoy, said they'd do a report, and that report is important. It's a report on the substance. Since that time, changes have been made both in our contract negotiations with LifeLabs and by LifeLabs to address the specific circumstances that occurred in 2019, and it's important to recognize that. But it's also important to recognize that the people that are trying to do these things are getting better every day, and that we have to get better every day. And so that's why we need to see the report. I expect to see the report. I support the report's release. I have a lot of respect for LifeLabs. They're key partners. As you know, they've been around in different forms since 1958 and associated with public health care since the beginning of Medicare in British Columbia, either through Metro McNair, through BC Biomed, and then finally LifeLabs. So this is a long-standing relationship in BC. We have great respect for the company, but we need to see the report. We need to see the report because it's important to British Columbians, and these are important issues.
I have a question.
Yeah, just a sec. Richard, go ahead. Okay, we'll come back to Richard. Vaughn Palmer.
Thanks for doing this, Minister, on short notice. Two questions. One, do you have any leverage because of the contractual relationship with LifeLabs to push them to release this report? And in the interim, is there any particular advice you would give to patients, to British Columbians, that are dealing with this company while this issue is hanging there in midair?
Well, the issue of the report is hanging in midair, but action has been taken by LifeLabs, and they've worked with the Information and Privacy Commissioner on that, and of course with us, to address the issues involved in the 2019 breach. So those issues have been dealt with. There is a renewal of the contract. You know that we shifted in the way that we did this contract. The province did in March or April 2017. And we moved to a more permanent contractual relationship. It was more fee-for-service before that with little control. And we've since, in this interim period, renewed the contract. And there are provisions in that contract that strengthen the privacy considerations and have a place to incorporate the recommendations of the Information and Privacy Commissioners of Ontario and British Columbia. So I think people can be confident that significant changes have been made when they go to LifeLabs, as I do, as someone with diabetes regularly, to get their tests done.
Next question is from Justine Hunter.
Thanks, Minister. I'm wondering if you're planning to change the law as Ontario already has, so that the Privacy Commissioner will be able to levy financial penalties for contraventions?
Yeah, this is a recommendation from the from Mr. McAvoy and others here in BC. There's a review going on of PIPA, and I think I think this is a good proposal and one that obviously we should consider. And it's one of the reasons why we have to see the report. I mean, I understand in their press statement today that Mr. McAvoy made reference to such changes, but we need to see the report so we can incorporate that into the standing committee process here and proceed if necessary. This is a critical area, and every single day it's something that health systems face. They are a target of this kind of activity. And so anything we can do to improve and strengthen controls is important. With respect to those provisions around fines, I think that's a proposal that makes sense, and we'd hope to incorporate that into the discussion of the Standing Committee. But we have to see the report, and I'm looking forward to seeing the report in full.
Am I allowed to follow up?
Yes.
Okay, cool.
Yes. Because
LifeLabs said that.
Would you like I think as the leader of the press gallery, you get a second supplementary as well.
I don't know that I'm the leader of anything. But,
Oh, it's Richard Zussman's the
So
leader.
she's not the leader
that's
now.
good. Yeah. So, okay, back in December.
You're the spiritual leader. You're the spiritual leader.
Back in December, LifeLabs said the risk to their customers in connection with the cyber attack was low, that they had not seen any public disclosure of customer data as a result. Is that still your understanding? Was anything ever, was any harm done from this, or is it still in a theoretical sort of zone?
I think that's correct. But look, you know, we're dealing with personal health information. So when you receive a letter, as many, I think hundreds of thousands of people in BC received a letter saying that a breach involving your health records occurred, regardless of the circumstances, there's reason for concern. So I think that's correct, but it's not correct to say there was no harm, certainly to LifeLabs and to public confidence and to everyone's view of the system, their confidence in the system. I think it's fair to say harm was done. So I agree with that conclusion, but I'm also we also have to acknowledge, as I did in December, I think, as I recall, this came out about December 17th, and you'll recall the interviews I think that we did and others did at the time. This is a significant event, and LifeLabs is a major part of public health care in BC and has been from the beginning. So we need LifeLabs to perform in this area, and I think improvements have been made commensurate with the risk and the threat.
Next question is from Binder. Sajjan, go ahead.
Hi, Minister. I'm just wondering, what do you say to the public who has trusted this company that is being used by the BC healthcare system? This company now, according to the Privacy Commissioner, did not appropriately safeguard their personal information and are seemingly getting away with it. There's no fine and no repercussions for not properly doing that.
Oh, I think there have been consequences, significant changes to address privacy in their contract. There's been this entire process that they've been involved in, the improvements they've had to make. So there have been consequences for this. And LifeLabs is a company, you know, back in December, there was a lot of discussion about whether this was the result of contracting out. LifeLabs has been a core partner of the province of BC since 1958 in one form or another. And you'll remember Metro McNair and MDS Metro and all the companies that eventually came together as LifeLabs. So they've been longtime partners in the system. But it's our expectation that they do better. That's why contract changes were made. That's why it's so important to see the report of the Information and Privacy Commissioner. And I do not agree with the idea the public interest lies in more information being provided to build public confidence. And that's how you respond to these things. LifeLabs is a great company and a great partner, but what this has shown is they and all of us have to do better.
Okay. Next question is from Lisa Yuzda.
Hi, Minister. Just following up on what Binder just said there, you say there have been consequences, but it sounds like the consequences are just them being required to do their job right. Michael McAvoy telling you that it's one of the most serious breaches he's seen. So how does this outcome dissuade other companies from not taking steps to provide this most private information?
Well,
until like someone comes down on them.
the act, the PIPA Act, as Mr. McAvoy has said, does not include fines at this time. He's recommending that fines be included into that, and that sounds to me like a good idea. That's why one of the issues that the Select Standing Committee is going to review, and then hopefully that we'll be in a position to act on. But you know, there are significant consequences for this, for a company such as LifeLabs that has a deep and long-standing relationship with the public. I think the consequences of what has happened, of the negative response to this, is something that LifeLabs has felt very deeply. I wouldn't believe that they wouldn't. So I agree with Mr. McAvoy that there aren't provisions for fines in the Act, and that's a good idea. And I think he has suggested, or at least implied, that had such provisions been in place, he would be recommending such fines. So that's something to be considered. But what the main thing to be considered, it seems to me, is the protection of personal information. And that is an everyday battle in government systems, but in particular in health systems, at every health system in the world. And as you know, I believe you may have reported on it, there have been a dramatic increase since the beginning of the COVID-19 pandemic in such attacks on systems. They happen every day, all the time.
Okay, we have Nick.
Just a follow-up here. It sounds like you're being quite deferential to LifeLabs. Is that because they're the only game in town, really, for getting testing, that we are bound to them as a society for getting these tests that we need? It just seems like if I did something like this in my job, I'd be fired. I'm
not being deferential. We want to provide excellent services to the public. What I'm saying to LifeLabs is, don't stand in the way of the release of this report. Embrace the release of the report. Let's get the information out, and let's do better. And that's what our expectations are. That's why we made changes in the contract. That's why we are insisting, and we insisted every day of this process, that the public be considered in full from October 28, 29, when we were first informed, November 7th, when we were informed BC Data was involved. That's our position. It's the position of the Government of Ontario. They do have a duty, and that is a necessary duty. Yes, it's an important company. LifeLabs provides an important service in BC and has dating back 60 years, but they also have to do their job properly.
Okay, we have Nick Wells from Canadian Press in for Dirk. Go ahead, Nick.
Hi, Minister. Thanks for taking my question. I'm just curious if this announcement changes any of the relationship that BC has with LifeLabs. You've talked about how they're standing in the way of a report. Is there any change in the partnership of how the province liaises with LifeLabs or works with LifeLabs?
Well, we have a contractual relationship, and it's our expectation that they'll fulfill that relationship and provide service to people in every part of British Columbia. So that's there every day. There's new expectations with respect to privacy consideration in that contract. They've responded, and I think Mr. McAvoy will agree with this, to the specific issues that had developed in 2019. And what he's saying, I think, if I read his interim thing or his press release correctly, is that that should have happened before, but that it's happened now. And so all of those things are important. But you know, this is an important public issue. It affects millions of British Columbians, potentially. And we paid for the report. We want to see it.
And last question is from Richard Zussman. Go ahead.
I got time for one. Unrelated question here, Minister.
Okay.
Are there terms of reference yet for Mary Ellen Turpel-Lafond and the investigation she's doing into the allegation of racism in emergency rooms?
They're being developed, and as soon as they're available and finalized, I believe Mary Ellen Turpel-Lafond will be making those public, and they're working on them now. The senior officials in the Ministry of Health, including Deputy Minister Stephen Brown, are working on that. So you'll see them soon, if not today, tomorrow, Monday, Tuesday.
That's all the time the Minister has. Thank you.
Just quickly, can I do a follow-up here, Lindsay?
Sure.
Just another unrelated topic, and I'll hopefully ask Dr. Henry about this later, but just while we have you, can you explain to us what's happened with the breakdown with the NHL in terms of the concerns health officials had about what would happen if somebody in the NHL's bubble tested positive for COVID-19 if they were in Vancouver as a hub city?
Well, there's no breakdown. Vancouver, and anybody who's paying any attention at all knows this, is the best possible place for them to come because we enforce public health rules in British Columbia thoroughly and completely. This is the reason to come. And you know, I love the NHL. I love the idea of hockey coming here, but I'm also the Minister of Health, and the players and the fans and those working at the arenas and everyone in British Columbia expects the rules to apply to everybody. And that's our advantage in this. It's not our disadvantage in this. The NHL will make its own decisions, and they're very intelligent people, and they'll have their own considerations, and considerations that might make Las Vegas or somewhere else a better location than Vancouver. But frankly, if you're talking about the health of the players, if you're talking about the health of society, if you're talking about public health measures, if you're talking about an outstanding leader on public health, if you're talking about a committed and outstanding leader in Premier John Horgan, this is the place to come, and I hope they come. We've made our pitch, our case, we make it 3 o'clock every day, which is that public health counts #1 in BC, and that matters for the NHL, and it should matter for everybody else.
Thank you, Minister.
Thank you.